all the listeners of Health Education Lecture Series. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408-687-1899. Email address homeomedicine HOMEOMEDICINE at yahoo.com. I'm here to deliver another lecture of health education lecture series as you are listening this series since long in different languages, English, Hindi and Punjabi. And yesterday it was in Punjabi, it was in Hindi. And day before yesterday it was in Punjabi. So we are passing through this series of lecture in abdomen section. In the abdomen, we have divided this abdomen into 9 different segments, and 9 different segments uh, are having different organs. That description has been given to you regarding the organs which are lying in a different segments. And now we are discussing about the pains or the complaints, just like I yesterday told in Hindi that the first and shortest word to explain the disease is a pain. And then that pain explains the history of the disease. In this field, physiology is known as the physical normal activity of these organs. Pathology deals with when this pain starts. Pain starts, that indicates something is diverted, something is changed inside the cells, in the functioning of the cell or in the structure of the cells, and ultimately how it is deviated, how it is changed in its structure, that is shown by the pathology. And that we have already described yesterday. And the normal physiological functioning is they create a normal life. But when there is any change inside the tissues, inside the cells, ultimately the first condition, the first change of the cell is known as inflammation. And if it is recovered in that periods, then it may be a temporary obstruction by some reasons, and ultimately those reasons have been removed, and now the pain has gone or the inflammation has gone. Whereas in the initial stage, I give you the explanation that pain is the obstruction or the blockage of anything which is working, which is running inside the body. And inside the body, I have told you the runnings are blood circulations, arteries and veins. Runnings are lymph channels. Runnings are the nervous system. So all these things are running, and all these things are related to each and every cell of the body. And it means if ever anything blocked in even a single in a cell of the body, it is indicated by pain in the initial stages. But ultimately, when this increases from one cell to the other, from the other to others, ultimately, if they involve organs, and ultimately the condition as is, this pain has its own categories. Its own category is known as inflammation, the first stage, which is recoverable. If all the obstacles has been removed, that pain is relieved, and that is known as inflammations. And inflammation itself has its sign: redness, immobilizations, pain, heat. All these are the signs and symptoms which are produced by the obstacles or obstruction of anything inside the cell or inside the organs or inside the system, wherever it is, how long it is, how big it is. In that way, and these are the initial conditions which are produced by this pain. So ultimately, if this is recovered, that's okay. But if it's not recovered, in due time, or it is going on, or the causative factor which are producing this kind of condition are not relieved, then it goes to the second stage of the inflammation, that is known as degenerations. By way of degeneration, it is the process of the nature, that nature wants to relieve those obstacles by other means, to you can say, the expel it out, whatever is garbage, whatever is the obstacles over there in the cells, in the organs, in the systems, wherever it is. And the nature by its own process dissolve all those materials and throw it out from the organs, throw it out from the body by the skins and all that, just like a boil. You see a simple inflammation, simple tumors. It comes up. It has pain because of its pressure, because of their collection, because of some obstruction, because it is blocking the ways, because it is pressing the nervous system, and we feel pain. And ultimately, if it is resolved in due times, or the causative factors are removed, then ultimately that inflammation goes off. But if it is not relieved, then nature has its own process to relieve from this kind of eruptions, vesicular, pustular, and all these conditions, that inside lumen is dissolved, or along with that one, the WBCs, the blood cells, are also died. And there are pus forming bacteria are appearing, and with the fight of pus forming bacteria, or what kind of bacteria are invading that area, they are fighting with the WBC forces of our body, and ultimately they are converted into ashes. And that ashes is known as pus, and that pus nature wants to expel it out. There are two ways of resolution of this thing. Either if it's a small quantity, it may be absorbed by the system. If it is more or excess and it is near to the expulsion area, that is the skin, then this pus formation is expelled from the body. And when it is expelled out, we say, oh, a tumor has burst out. So this is what the resolution of the second stage of this one. But this, if this resolution is continued and growing every moment, and then sometimes any organ which is affected, sometimes any parts which is affected is unable to function, then that area is known as necrosis, necrosed area, that the local area, the local tissue which were functioning over there are now no more active, now no more able to recover to their normal functions. So this is known as necrosis. And ultimately, if this necrosis is still not recovered, if this necrosis is still not localized and bounded by, then ultimately it increase on its area, and increased area may damage a local part of the body, including the functions and everything. And ultimately, that pus may continue to ooze out, but even then it is not recovering. And ultimately, the area of inflammation, area of degeneration, area of necrosis is going on increasing. That is known as gangrene. So these are the conditions of that pain. Pathologically, we can explain all these things, that simple pain starts from the blockage of any flow inside the body. The flow, I have already told you about the flows, that it's a arterial blood, it is a venous blood, it's a lymph channel, it's a nervous system. So all these things are moving all the time. Though cell is also itself moving, cell is also in continued moving if it's surviving. So in this way, all these things are ultimately ultimately the organ is damaged, and it is not recoverable sometimes. So that's called as gangrenes. So in this way, in each and every disease, stage of this development of the inflammation happens. Means the stage of pain in this way, in every organ, in any disease, in every disease happens. And we have to find it out, that what organ has been affected and what is the stage of that organ, whether it is in the initial stage of inflammation, whether it is in the second stage of degenerative and type of things, or whether it is in the necrosis type of things. And ultimately, in this way, sometimes we come across the conditions that no, this organ may not be able to work further, and we need to remove these organs. And ultimately, by mean of surgery and what else we can do, all those things, because we are unable to because by our knowledge, by knowledge of medical science, we are unable to recover that one. So this is what going on each and every disease. So this explain the history of pain. This explains the history of disease itself, because the smallest explanation of the disease is pain, obstructions, and that goes on worsening. And ultimately, that worsening, where it is, it depends. The symptoms are changed. Suppose this condition is happening in the liver, it will indicate some different kind of symptoms. If it's this pain is related to the spleen, it will indicate some different kind of symptoms. If this is related to the kidney, pain, inflammation, degeneration, necrosis, all these things, these are the stages. These are the stages, and these stages are happening throughout the course of the disease. In every disease, any disease, you may name any disease, it's a pleurisy, it's a pneumonia, it's arthritis, whatever it is, these cells are showing this kind of stages of development of the disease. And these type of stages has different kind of symptoms and indication in different kind of organs, in different area of the abdomen, different area of the body, and different area of the organs as well. So these are different, and their indication is different, but the process is this one. When an organ is still workable, though there is inflammation. That's the first stage. But when this organ is separating the inflammatory condition at one side and still continue to work, that's known as degenerations. But when it goes beyond that limit and ultimately a resolution comes up and nature wants that the organ should continue, there is a liver abscess. There is a abscess anywhere inside the body. There is anywhere abscess or tumors on the skin or muscles. Ultimately, the resolution is that the pus formers will dissolve the superficial tissues, and ultimately that will come out in the shape of pus, so that the other organs, all the other the muscles and everything should continue to work normally. But if it exceeds beyond that one, if this pain exceeds beyond that one, that the stage I told you about the necrosis. So in this way, this pain is explaining its character in different organs of the body at different stages of the inflammation stages, different changes inside the tissues. It indicates differently. And that is why the doctors have a term known as differential diagnosis, because many of the pain means pain. Differential diagnosis means we have to differentiate the characterize the pain, and on the basis of characteristics and some accessory symptoms. Suppose jaundice is concerned with the liver, it will not come up in pneumonia, it may not come up in the other problems. So in this way, some of the symptoms are related to this category of inflammation, degeneration, necrosis, and gangrene, and some accessory symptoms are following what organ specifically is affected with this pain. I'm not saying the disease, because name of the disease are termed later on. Doctors and medical science gives different names to the different diseases, but this is pain. When this pain is in the liver, it has hepatitis. When the pain is in the stomach, it is termed differently. When the pain is in the different organs, it is termed differently. Or in the kidney is a pyelitis, and all these things are different terms are used, but they are explaining the same thing. They are explaining the situation of the cells inside condition of the cells inside, and when they are up to the condition of degenerations or a limited necrosis, we can say that yes, it is recoverable, and we try to recover that one, manage that one, to help the nature by means of medicines and the management, so that those tissue recover back to their normal conditions. But when the stage has gone up beyond that necrosed area, it has developed a large area, it has covered a large area inside the organs. Now the organ is unable to function, whatever may be the condition, whatever the pathological condition there was. But if there is, that has exceeded the stage of necrosis and gone to the gangrenous stage. At that stage, it is unable. We are unable, as a medical science, we are unable to recover easily. But nowadays, there are many more things we are trying to recover all those things. Even but when the organ is damaged, it's unable to recover or restart its functioning normally. Then we have only the alternative to remove that organ from the body. So this is what the explanation of the pain. And in our previous lectures, with the series of this health education lectures, we have reached to the abdominal area. And in this abdominal area, I have described that, to easy understanding for this abdominal area, we have divided this abdominal area into 9 different sections. And 9 different sections were divided by 4 different lines, imaginary lines. 2 lines were coming from upward to downward, that is known as mid clavicular lines. They are drawn from the middle area of the clavicle and goes vertically downward. And 2 lines are taken from the just under the bottom of the ribs, where the ribs are finished from the chest. And the other line is known as the transtubercle plane, which is from where we put the belt, our belt of the pent, we put over there. That's known as a transtubercle plane. Easy to understand that one. In this way, the abdomen was divided into, I can show you a picture if you can understand this one. This is all the 9 sections, and I have described it into this one, that this one is the right hypochondric area, and this is, it has liver in that one. So I can do this way: the right hypochondric area, right side upper quadrant, and the next to that one, to the left side, is a epigastric area, and left to that one, that is the left hypochondric area. And below the right hypochondric area, there is a lumbar area, that's known as renal area as well. And from right lumbar area towards left side, there is the umbilical area. And from the umbilical area left is the left lumbar area or the left renal area. Below that, there is a right inguinal area, and next to that is the hypogastric area, and next to that, toward the left side, is the left inguinal area. So all these areas I have many times described in these lectures without the pictures, but I am showing you the picture so that you can easily understand from where the lines are coming up. So in this way, the right inguinal area is also known as the iliac area, right iliac area and left iliac area, because ilium tuberosity or ilium bone, they are the nearest, and we start the line from that area. So right iliac or the right inguinal area, these are the 9 sections of the abdomen. And yesterday, in our lecture, we have described in Hindi that in the right area, in the right hypochondric area, there is a liver. Main portion of the liver lies on the right side, but yes, some of the portion goes to the this epigastric area as well. Small portion of that one, and that the bigger portion of the liver is lying just under the ribs, because I told you that this and some of the organs are lying under the ribs. Though we have said previously that the up to the ribs area, this is considered as the chest area. And chest area is having major important organs of the body for the life to run. Respiratory organs, just like the lungs, the heart, for the circulations, and all these things. These are the major section of that one. But even then, liver is lying under the ribs, but it is the abdominal organ. On the left side, the spleen is lying under these ribs, but it's a abdominal area, abdominal organs. So these two, three organs, just like the stomach, the upper end of the stomach, or the cardiac orifice of the stomach, they are lying close to or under the rib margin. And but they are abdominal organs. Why they are abdominal organs? Because all the abdominal area organs are covered by a wrap, two folded, that's known as peritoneum. So all these organs are covered by the peritoneum. That's why they are known as this. These are the abdominal organs. But though they are situated, or they are taking some place from the chest areas under the ribs. So when they remains inside the ribs, they are normal. But when they come out of the ribs, the lower portion of the ribs, they are termed as sick and painful, as something is wrong with these organs, and then we start treating all those things. And yesterday I was describing about the right hypochondriac reason. So the right hypochondriac reason, or the hepatic reasons, uh, you can say it is just under the right lung, lower lobe of the right lung. It is separated by a pleura, and also the coverings of the peritoneum, which is wrapping the liver area in this. There's this separate over there. And this area is a dome shaped, just like the gumbad type. You can say that that's known as dome in English. And underneath that there is a liver on the right side. Mostly we say it's on the liver right side, but it's not only in the right side, it's also in the other area toward the left sides, because it's a long, just like head of the fish, body of the fish, and the tail of the fish. Like that one, this liver is from right side, goes towards the left side areas. So yesterday I described you that in this right hypochondriac area, the main portion of the liver, and underneath the liver there is a gallbladder, and also from the same area, right hypochondriac area, the portion of the ascending colon of the large intestines. Large intestine coming from downward to upward, and it passes through from this area and takes a turn towards left. From right side, it goes to the left side. The large intestine, which is having digested food, which is having that a type of converting the stool or whatever, but at this time still it has some type of minerals and all those which are being squeezed from here, from the largest intestine. I will describe it later on. But so I'm just telling that in this area, mainly gallbladder, bile duct, common bile duct, liver, and also the portion of the ascending colon, and also the hepatic flexor from where it takes turn to the left side, and also a portion of the transverse colon when the large intestine from the right hypochondriac area goes to the left side. So some of the portion of this one is in this area. And if there be any pain, just like the function of the liver is to produce continuously it produces bile, and that bile is also stored in the gallbladder area. Okay. And when we are sleeping, this, because liver is secreted continuously, when we are eating, this bile goes directly to the intestine, that is the first 10 inches portion of the small intestine after the stomach, on the left side, and it is poured over there to function for the fats, for the other type of toxic substances, to neutralize them, and all that. I will describe it later. But that portion is known as ampulla of Vater. Ampulla of Vater is a section in the small intestine. This bile duct goes over there. But when we are not eating, but this bile is secreted continuously from the liver, it is stored in the gallbladder, and gallbladder is full of that one until we eat again, and it goes directly over there. So ultimately, in this liver section, the main important thing is that the all portal system blood. Portal system means, I have described it many times, but I want to describe it here. When a child was in mother's womb, and mother was supplying food, oxygen, everything via the blood, that is known as umbilical cord. That umbilical cord is attached to this our umbilicus, and underneath that it goes to the liver. Later on, when the child is born, ultimately it is converted into the round ligament of the, it dries up, it becomes a round ligament of the liver. Also in this way, at that time, this food, which is supplied by the mother by the umbilical cord, when the child is in her womb, then there is not much work should be done, or the liver needs to be done. Ultimately, it goes to the circulations via the azygous vein. There is a one vein from the liver which goes to the heart, and it put this all everything whatever it is coming from the mother to the right atrium in the liver. So this is normal process. But I'm talking about when the child is born. Ultimately, when the child is born, then a new system starts up. New system starts, that's also over there, but it start functioning over there. That is known as the portal system. That portal system drains its blood. One more thing I would like to clear here. Blood from the heart goes to each and every cell of the body, and from by the arteries, and from each and every cell blood goes back. When it comes, it has food, oxygen, everything. But when it comes back, it has without food, without oxygen, minimum, plus the garbage of that blood, then that cell, it is taking out and going back to supply again to the heart. This is the normal process, everybody knows about that. That the circulation, this is known as systemic circulation. In the systemic circulation, from heart to cell, from cell to heart, this is what we know, everybody knows that one. But I'm giving you some specific type of change in this system, that the blood going back from intestines, from the anus onward, all intestinal portion, which is up to the duodenum. Okay, blood from the intestines goes back via the portal system to the liver, not directly to the heart, but because it may have more garbage, it may have more something which is not acceptable by the systemic circulations. It may cause some damages to the circulation and also to the other organs. Therefore, the nature has made some arrangements that the blood, when going back from the intestines, intestine means the end of the intestine is anus, from anus, rectum, sigmoid colon, and all that one, the blood goes back via the portal system to the liver, not directly to the heart, just like from the other organs. And when it goes to the liver, liver works like it separates everything. It separates everything: glucose, sugar, cholesterols, iron, and everything it separates. over there. And whatever is, and whenever is, or how much is required normal sugar for the circulations, it sends back via azygous vein to the heart. How much cholesterol is a normal requirement of our blood should go to the circulation, systemic circulation, to be distributed to each cells, it sends out there. Same way, all the things which are coming to that one, it distributes according to the requirement of the systemic body. And if there is excess of sugar or excess of everything, it stores that sugar in the shape of glycogen. It remains stored in the liver. And ultimately, ultimately, when minerals and irons are coming, we have eaten everything. And from that one, I'm just giving you one example. If the iron is coming up back from the intestinal blood to the liver, it is broken down into bilirubin and biliverdin. These are the bile pigments and bile salts. And bile pigment and bile salts, they are responsible for giving a color to our skin, for giving a color to our eyes, giving a color to our urine, and also the stool. It means how much is required, it sends back to the circulations. Whatever is extra in the food materials, sugar, fat, iron, and other minerals, if they are coming in excess, liver stores that. Liver stores that, and the normal quantity it sends out. But suppose if anything is excess than normal, just like I told you, the iron is broken down into bilirubin and biliverdin. And when they are in excess, ultimately, liver has a limited storage. Liver has limited storage. It means the extra, whatever it will be, it will send to the circulations. It means something is damaged. Something is damaged. That is why the iron is more broken down, or iron is coming more and broken down, and then excess of bilirubin or biliverdin will go to the systemic circulations, and heart will distribute it throughout the body. What will happen? Our eyes will become yellow, our urine will become yellow, skin will become yellow, stool will become yellow, because normally our stool is brown colors. So everything changed because of the collection of bilirubin and biliverdin, because of the bifurcation of this iron into the liver in that way. Suppose if there is excess of sugar, there is excess of sugar, and then ultimately liver stores this sugar in the shape of glycogen into the liver, and whatever quantity is required by the systemic circulation for the whole body, it sends back by via azygous vein to the heart to supply it to the whole body. But suppose how long? Liver has its capacity, liver has its limitations, and ultimately, if it is beyond that limitations, that sugar will go to the system, and that sugar will go to the system. And ultimately, when we will see, when we will check the blood, we'll, oh, you have excess of sugar, because the normal quantity, we know that 80 milligrams per 100 ml of blood in a normal quantity, we say it's normal for everybody. But if it's increased, excess storage of the liver has more sugar in that one, and ultimately it will go to the systemic circulation. Even just like I can give you one example to remember that one. Suppose if you go to the party, if you go to the party and you take more sweets, rasgullas, jalebis, and all that, more in excess, but you are not taking normally, what will happen? It will go to the intestine. From the intestines, whatever the blood is going on or whatever the garbage, the intestine will send the garbage back to the circulation, and that circulation, the venous circulation is known as the portal system, and that portal system will squeeze that one, and excess of sugar will send it to the liver. And now you might have seen that when you go to a party, next day you do not want to work. There is a lethargy, sleepiness, tiredness, all you feel because the excess of sugar you have taken, and the liver was having a limited storage. The excess of sugar, it was bound to send into the circulation. It was bound to sell into the circulation itself. It sent it. And ultimately, everywhere in the cells, everywhere in the tissues, there is a excess of sugar. And you know, cell has many components: nucleus, Golgi body, mitochondria, centrosomes, lysosomes, fat globules, sugar globules, air bubbles. There are many more in the cells. And if anything extra forcibly is invaded into that one, ultimately what will go out? What will go out from the cell? That is the oxygen. Air, mostly, if anything is in this room, just supposed to, we put something extra stuff in this room, what will go out? The space will be taken up, and the air in this area will be minimized, it will go out. The same way in the cell, it's normal understanding. The same way in the cell, the oxygen goes out, and oxygen is a life. Ultimately, oxygen with which our cell is surviving, our cell is functioning. And if sufficient oxygen is not supplied to the cell, what will happen? It will feel tired. Even if you, from the normal area where you live, if you go to the hills top, you are going hiking, you feel breathlessness because the oxygen is less over there in the concentration in the environment. The same way happens, you have gone to the party and you have taken more sugar, and even I will come to the fat, more sugar, and that the storage of the liver was limited, and ultimately liver was bound to send it into the circulation. Because it, suppose, think, if this was a routine, just like the other organs routine, that they are sending their venous blood directly to the heart, what will happen? The excess of sugar will go to the heart, and ultimately it will, the same quantity will block many of the organs. Whereas this stopper, this custom department, liver, will store most of it. That no, 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 you cannot go over there. And whatever storage I have, I can keep it here in the shape of glycogen. And okay, the rest of it. But if still it's more, it will go to the circulation, and ultimately will go to each and every cell, and each and every cell will be having less loss of oxygen. First of all, loss of oxygen will feel tiredness, lethargy, weakness, do not want to work. All these things happen next day of the party when you go to this. In the same way, and that sugar remains stored inside the liver. But if you do exercise, you metabolize that, or in a due course, in one day, next day, you do not eat that much. And ultimately, the reserve food material of sugar, glycogen, will be used by the liver to send it into the circulations, and that storage will be over. Then you feel active. Okay, yeah. After the party, I was very tired, and now next day, yeah, there was Sunday, yeah. I was going to the party on Saturday, and I took some rasgullas and jalebis and all that one. And ultimately, next day I was unable. I wake up very late in the day. I was supposed to wake up at 8 a.m. or 7 p.m., 7 a.m., but now I wake up 12 a.m. or 1 p.m. and like that, that one, because I'm tired. And I take a rest. But ultimately, after that, if we work out, exercise, do some work, and do not eat in timely fashions, ultimately that reserved glycogen in the liver will be used, will be sent to the circulations, and you will be normal. After that, oh, Monday, yes, we are okay to go. This is normally happens in this system. And suppose if there is a excess breakdown of iron, I told you what will happen. Same thing. Or if you have eaten more spicy thing, pakoras and all these ones, spicy, salt and everything, liver stores it. Liver blocks it. It's custom department. No, you cannot go inside our country. Okay, they do not allow them. And ultimately, but if there is a limited storage for each and everything in the liver, and ultimately, if it is excess in the quantity, that goes into the circulation. What it can do? What liver can do? It has a specific place over there, and then when it goes to the this salt, it goes to the circulation. It goes to each and every cell, and each and every cell ultimately what will happen? The nature of the salt is to attract water. Nature of the salt is to attract water in it, just like in the rainy season. Suppose you have a salt pot in your kitchen, and you just open the lid of that one, and though it's inside, the rain is outside, it will attract moisture from the environment, and this will become moist. Your dry salt will become moist. I am just telling you the nature of the salt. The same thing, when excess of spicy pakoda, this and that, you have eaten it, and chicken, meat, whatever, goat, you have taken, and more salt has gone inside your body, and the liver has scrutinized it. But even then, it was excess from there, its limit, and it will go to the circulation, will go to each and every cell. What it will do? It will attract more water inside the cells, and cell will feel difficulty. Cell will feel difficulty, and what will go out? Again, the oxygen. And moreover, the cell will enlarge its space, and every cell will enlarge its space. Sometimes you see some of the people are having swelling below the eyes, swelling below the eyes. Why? Because there is a salt retention, and water, that's known as water retention. Why the water retention? It should go normally because there is a salt, excess of salt inside your body. And also, when in circulating blood, it's excess of this one, and the salt has attracted more water into the blood vessels, blood, there will be blood pressure. That is why doctor says, okay, take less salt. But even there is a normal quantity of the body to consume salt. We need that one. But if the absorption of the blood, absorption of the salt has been changed, has been damaged, ultimately, even if you take a small quantity of salt, it will increase your blood pressure. Or even if it is damaged, even you take more salt, but if some people, you will say that they are taking more salt in sweets and in vegetables and everywhere, but even then they do not have blood pressure, because their system inside is having less assimilation of the salt, means the salt is not absorbed by the cells. That is why even after taking salt, you do not have blood pressure. Craving. How the cravings are produced? When anything in the cell goes in deficiency, and not only the one cell, trillions of cells produce the same thing, the deficiency, they crave for this one. Ultimately, the center sends us more over there. Okay, this is the deficiency over there. Then we crave for that. The message goes to the signal goes to the brain. and we crave for that. Though this system is related with the thyroid gland, I will tell you later on, but I'm just explaining the right hypochondric area in the liver side. And the liver has this kind of a functioning: whatever you eat goes to the intestine, absorbed there, goes to the blood, but blood circulation, which is going to supply the food to the intestine. It does not mean that, suppose, just like you can understand easily, the heart has more blood. Heart is taking all the blood. It does not mean that heart can use whatever he wants to. No, it is not. And the common kitchen, it does not mean that the kitchen person can eat the best of the food and he can save for himself. No, it's not. He has to sit the same in pangat and same in line to take his food when it is his turn. The same way in the system, food goes to the intestines. From the intestines, whatever we have eaten, it is absorbed from that one and goes to the blood to make new blood. But to make intestine healthy, understand, to make intestine healthy or running, intestine needs its own food supplied by the arteries, and that blood is supplied by the arteries to the intestines. And also, after being supplied or taking up that one, the intestines are to send back the garbage. That is the venous circulation. So that venous circulation from the intestine is not directly going to the heart, it goes to the liver. And we have given a separate name for this circulation, that is known as portal circulations. And the portal circulations may have anything in excess, more garbage as compared to it is coming from the other tissues. If a tissue is sick, if tissue is having cancer, if tissue is having ulcer, if tissue is having any problem, yes, more garbage will come from that one. But even then, when it goes to the different organs, to the skin, to the kidney, to the breathing, it is, most of the garbage is relieved by this one. But this system has excess of garbage in the going back the venous circulations. The venous circulation of our intestine has more garbage because it is directly connected with the line of food we have eaten. We have taken food and it goes to the intestines. And from that area, excess of garbage may be collected. That is why the nature has set up a new system for that one, because when it was mother's womb, she was taking care of everything, for food, for minerals, for fat, for sugar, for oxygen. Everything was taken up by that blood. But now, after that, nature has set up a new thing. No, now there is no mother. You have to do that. And then he make responsible our liver. Okay, you have to take the responsibility. You have work like a custom department, and you have to scrutinize whatever blood is coming from the intestines back, supposed to go to the heart, should not go to the heart directly, should go to you, and you will scrutinize it. You will check it whether or not it is having normal quantity which is required by the body, or it has excess quantity of anything, or it has less quantity of anything. If it's excess, I told you about the sugar. If it's excess, I told you about the cholesterol, different type of cholesterols, total cholesterol, HDL, LDL, VHDL. There are different forms of these. I will describe of the cholesterol later on and what type of the cholesterol there. But liver try to store all these things. If they are coming from the intestinal blood more in quantity, but it sends to the heart limited quantity. But when the storage is full, and liver is bound to sell it more. Liver is bound to sell it more. And ultimately, that is what's shown when we check the blood. Oh, your cholesterol is high. Oh, your sugar is high. So all these things we check when it goes to the. It means liver itself is in problem. Liver has its problem, and when this liver has its problem, ultimately what the liver has to produce as a garbage, that's the bile. That is known as secretion. And about the secretion and excretion, I told you many times that excretions are those which are released from the body outside the body, and they are not used again. Just like stool, urine, sweat, breathing, we do not use it again. It's a different thing that Morarji Desai was drinking its own urine. But normal thing is we do not. These are known as excretions. But there are some other secretions. They are also secreted by the organs, but it's their garbage. It is their garbage, but it is not expelled out from the body. They are still used by some others. In my home something is extra, and I give to the neighbors there. Okay, yeah, this is extra I have, and you can use it. You need it, you use it. The same way, many of the things which are released mean as a garbage, as a extra from one organ, and that is used by the other organs for its function. The same way, the bile is a garbage of liver. It's a secretion because it is not expelled out from the body. It is a secretion. It is used by the intestines for its purpose, for the digestion purposes. Same way, there are many more others, just like the endocrine glands I have told you. Endocrine glands secretes their hormone, that is their waste, that is their garbage, going to the blood circulations. And that is not expelled out from the body, but is used by the other organs inside the body. It's used by other organs for their purposes. Suppose pituitary gland produces hormone TSH, thyroid stimulating hormone. What does it mean? It produces a hormone which stimulates the thyroid gland. If it is not produced over there, then thyroid gland will not work. And then the thyroid gland relatively affects on the gonadotrophin hormones. Under effect of that one, our testis, our ovaries functioning. Pituitary gland is secreting testosterone hormone. It stimulates its function, and the testosterone testes are able to produce testosterone hormones. Ovary is capable of producing the estrogen or progesterone hormones. All these things are relatively known as secretions, though they are the garbage. Stool is a garbage, urine is a garbage, hormones are garbage, but there are two different names: excretion and secretions. Excretions going out of the body, they are not used again, but the secretions are inside the body, they are used again, just like the honey from honeybee. Honey, that's the waste product of the honeys, but we use it as a tonic. In the same way, this is what happening in the liver. Now, how long the liver can work and can store all these things and maintain the health? It's a limit. Ultimately, when that limits are crossed to a maximum extent, it means the maximum storage is blocked inside the liver. The liver function will be damaged. And the liver function, what is liver function? To produce bile. Means its bile is not in the normal quantity secretions. It has something wrong which is going to the circulations, and that can damage, that can sign up with different type of symptoms in the system. This is what I told you. Because of the bile, means whenever there is a problem in the liver, there is a yellow skin, there is a yellow conjunctiva of the eyes, there is a yellow urination, there is a yellow stool. Means their normal color is changed because there was no bilirubin biliverdin. Normal quantity is lost. In this way, the sugar is excess. We can check it by the blood that it's going on, what it indicates. But mostly, everybody knows that if there is a excess of sugar, it means pancreas is not working, because everybody told us that the pancreas is responsible to metabolize the sugar. Whatever we eat, rasgulla, jalebi, whatever, in a normal quantity of food, even everything which is whatever we eat, carbohydrates, fat, proteins, whatever we eat, ultimately when it is ready to be mixed into the blood, this is converted into sugar, a type of sugar, but the name is different. If sugar is made from the protein, it is known as amino acid, but it is a sugar. Sugar has its own characteristic. It's a dissolvable, it's a sweet in nature, and it can mix up everywhere, just like the sugar, our normal sugar and the kitchen sugar, like that one. The same thing. So we eat fat, it is converted into sugar. We eat carbohydrates, it is converted into sugar. We eat proteins, it is converted into sugar. But their names are different. Names are different, so that they are able to be dissolved into the blood, and they are able to be mixed normally, easily into the blood. But if they are in excess, we can detect it, we can check it. And if they are excess, what they cause, we can see that. The same way, the damages of the livers we can detect basically whenever there is any damage in the liver. That is the first and primary sign of the liver is, remember, we are talking about the pains. The pain is the disease. The first initial sign of the disease, it will be indicated by yellowness. Okay, and there are many more other signs we will discuss when we will come to the liver. But I'm just our chapter was today to discuss about the differential pains, different kind of pains inside the abdomen. And in the right hypochondriac area, the first thing we have discussed about the liver. And what's the function means? Produce liver, produce garbage as a gallbladder. Sorry, as a this bile. Okay, so liver produce bile as its garbage, but if the garbage is not relieved, because his storage is full because of some other things, and ultimately its garbage is not relieved. And if the garbage is not relieved, it will be shown up by the yellowness and all other things. And there are many more other. Now we will next time, because today time is over. Next time, in next lecture, I will describe you what is the characteristic of that pain. Sign and symptoms. Now we told you. Characteristic, how this pain goes, how this pain is transmitted, when it happens, how it is transmitted, where it is migrated. All these things I will discuss it tomorrow. Okay, in my tomorrow's lecture, everything we will sum it up. Okay, God bless you all. I'm your host, Gurdeep Singh Sandhu, homeopathy consultant. My clinic address is 9701 Sarah Ann Court, Dublin, California 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease and you want to take a second opinion about your disease, and if there is no progress, you are tired of with the treatments, you can call me to take a second opinion. Or if you want to be treated by scientific homeopathic treatments, you can call me at 408 687 1899. Rabarakha, God bless you all. We'll see you tomorrow. And the same request I'm repeating, which I repeat every time. If ever you think these lectures are beneficial and you are getting some knowledge about your body, about your health, and you will be benefited from this one, please convey this message to your nearest and dearest, so that they can listen these lectures and they can understand about their bodies, and they can get well if they become sick in case. So God bless you all. We'll see you tomorrow.